Welcome to those who are just joining us. We'll give folks a few more minutes to sign on. Sending a welcome to everyone who's joining us. We'll give folks another moment to sign on. Okay, well, we are at 4 o'clock. I want to welcome everybody. My name is Margie Beaudry. On behalf of Trust for America's Health, I'm very pleased to welcome you to today's Huddle call to discuss challenges and solutions for ensuring access to COVID-19 vaccines for older adults and people with disabilities who cannot leave their homes. Please mute your lines unless you are speaking. This session is being recorded so that we can capture all of your ideas and the experiences that you share. This call series is part of an initiative to identify and foster adoption of innovative practices and promising solutions on this topic. This work is made possible through the generous support of the John A. Hartford Foundation and the Cambia Health Foundation, both of which are dedicated to improving health for all. TIFA has been leading efforts for the last few months to explore the challenges of ensuring that older adults and people with disabilities have access to the COVID-19 vaccine. We have learned a lot and have heard from so many people, like those of you on today's call, that there are solutions and strategies to get the vaccine to these populations. As we learn about the challenges, such as defining the term homebound, finding these individuals, expanding the pool of vaccinators, and ensuring full reimbursement, we've also identified some policy recommendations that will soon be published and disseminated to help inform and guide policy leaders across the country. We are very pleased that there is growing attention among the media and federal agencies, including the VA, CDC, and ACL, as well as national stakeholders. But there are still a lot of complexities, and there's no single strategy for ensuring the vaccine gets to those who are homebound. In studying this topic, we are seeing some themes emerge, such as increasing the vaccine supply, ensuring access for caregivers, vaccine hesitancy, and identifying those in need. Over to you, Megan.
Great. Thank you so much, Margie. We are really gratified today to have with us one of our really strong partners in this effort from the Administration for Community Living, Edwin Walker, who's a Deputy Assistant Secretary for Aging, and he's going to share a little bit of background on ACL, but also talk about some of the issues that we're addressing through this initiative today. So Edwin, thank you again so much for being with us, and I'll turn the floor over to you.
Thank you so much, Megan, and thank you, Margie. And I understand that I'm working with Shauna, who's going to advance my slides, and I told her that I'm going to move pretty quickly through some of them. So let's see. You can go to the next slide. Thank you, Shauna. So just to give you a little background, the Administration for Community Living, we were created in 2012. We're the newest operating division or program division in the Department of Health and Human Services, and it really brought together aging and disabilities. And there was quite a bit of discussion at the time of the creation of the agency, because the question was, well, what do we name it? Do we name it the Administration for Aging and Disabilities, where the aging comes before the disabilities, or disability and aging? And we decided to name it after the aspirations of the populations we were serving, therefore community living. And the point here is that we're really focused on accessing community supports with a mission to maximize the independence, well-being, and health of older people, people with disabilities across their lifespan. And we're really focused on the vision that all people, regardless of their age or their disability, should be able to live with dignity, make their own choices, and participate fully in society. Next slide. So on the aging side, this depiction is what we refer to as the National Aging Services Network. And we work in partnership with our colleagues at states and area agencies and throughout the country with thousands of service providers. It's a network of community-based organizations who come in contact with and relate to older individuals on a daily basis. And they really are known to be the visible, trusted sources of information, assistance, and support, regardless of the topic. So if the Centers for Medicare and Medicaid Services puts out something related to Medicare or health insurance, folks, older people in the communities turn to this Aging Services Network to get visible, trusted resource of information. Next slide. So in terms of who we serve, we are focused on those in greatest social and economic need. So we serve the poor and the near poor, those who are frail and vulnerable, such as those living alone, those with chronic conditions, minorities, and those living in rural areas, people who are at risk of emergency room visits and hospitalizations, as well as at risk of going into a nursing home. Again, our goal is to enable people to stay in their own homes for as long as possible. So it's important to note, however, that the type of person that we are serving at home and in the community are individuals who have the same functional level as individuals who are eligible to go into a nursing facility. So we want you to just have that in your minds as you're thinking about the folks that we're serving. Next slide. We really focus on the issues of health and independence in the provision of home and community-based supportive services. And for purposes of today's discussion, I just highlighted a few of them in terms of providing adult daycare, providing case management, information and assistance about obtaining services. Our largest program is our nutrition program. And with our nutrition services, more than half of the individuals we serve indicate that one meal we provide a day actually represents more than half of all the food they get for the day. And 9 out of 10 of the individuals have indicated that the meals we provide actually help them stay in their own homes as opposed to having to go to an institution. Another example is in the area of transportation, where more than half of the transportation services that we provide represents, more than half of the people we serve, indicate that the transportation services we provide is what they rely on for a majority of their transportation needs. And without it, they would be homebound. They would have no way to get throughout the community and perform activities of daily living. 2/3 of the individuals live alone. 14% of them take more than 10 medications a day and represent a safety risk for driving. And 3/4 of our transportation clients have incomes at or below $20,000. Next slide. So when we talk about who we serve, most people think, well, you're the administration on aging part of ACL, and you're just serving older people. And that's too limiting. What we really do in the Aging Services Network is we serve a variety of people of all ages, because as we focus on aging, we focus on it as a process, not any one point in time. And we also focus on the challenges that people face with long-term care and with living in the community. Next slide. So as we think about the Aging Services Network, and specifically with regard to providing assistance with vaccine administration, our network has already been providing these categories of services: outreach and education, securing appointments, facilitating, getting appointments, and hosting vaccination clinics in age-friendly locations. And that's because we know that a large center may not be appropriate for an older person or a person with disabilities. Having to be with a whole lot of people standing in line or waiting in line for a long period of time going to an age-friendly location like a smaller senior center that they may be familiar with, where they can be in and out, or assisting someone to go to their local pharmacy is a much better approach. The additional component that we're doing is we are identifying older individuals who cannot safely be transported to community vaccination clinics. And for these individuals, we are coordinating with public health and other partners to arrange for in-home vaccinations. And we're working with CDC in that regard. Next slide. With regard to our administration on disabilities, the other side of the house, from a program standpoint, they're really focused on equipping individuals with opportunities and tools and supports to lead the lives that they really choose to live in the community. They move to the concepts of community living and inclusion and partnership. They focus on increasing employment opportunities and financial well-being of individuals, as well as the concepts of independence and self-determination. Next slide. I want to focus on what the Administration on Disability programs represent in the states. At the state level, they have state councils on developmental disabilities, state independent living councils, and traumatic brain injury state partnerships. And with regard to COVID, we've been educating policymakers about the needs of people with disabilities to ensure equal access to COVID testing, to treatment, and to care, as well as filling in gaps in services and supports and developing accessible resources for people with disabilities. Next slide. At the community level, we have the Centers for Independent Living, the protection and advocacy systems, and with regard to COVID, they're providing individual assistance to equal access for care and treatment. They're providing peer-to-peer information sharing, and they're addressing the issues of social isolation, food insecurity, and a lack of transportation. Next slide. With regard to the university community, we have the University Centers for Excellence in Developmental Disabilities, and they're providing assistance and subject matter expertise to other state agencies, including health agencies, on addressing the specific needs of people with disabilities. And they're providing services and assistance to children, families, and individuals with disabilities. Next slide. We are very excited about, and we are successful because of the many collaborations and partnerships that we have. Of note for today's topic, we're partnering with the Centers for Disease Control and Prevention with regard to providing assistance with vaccine administration. We have made presentations to their immunization awardees, and we're focused on connecting their network with our network and our resources. And we've also been coordinating with the Office of the Assistant Secretary for Health. We've been trying to really connect the state and local health and aging agencies in government and throughout the country as part of our longstanding Healthy Aging Initiative. And that's been designed to really bridge health and human services, and in this context, aging. Next slide. Our partnership with CDC has resulted in a memorandum of understanding, a memorandum of agreement that was included in an announcement by President Biden when he recognized that vaccinations are critical because older people and people with disabilities are significantly more likely to have a severe illness or be hospitalized or even die from COVID-19, and that even if they meet a state's criteria to receive a vaccine, they may face significant barriers to getting vaccinated. And so next slide. So the result was CDC providing $100 million to the Administration for Community Living through this memorandum of agreement. And it was designed to really expand access of the vaccines to our population, to those who are most at risk, those in need, the hard to find individuals who may not have access to the systems that have been developed in the states. And so we were able to receive this $100 million, and we're distributing it now. We've already provided 50 million to our state units on aging so that they can provide it to the area agencies and get to the community-based organizations that are the hands-on folks coordinating with public health to assist in vaccine administration, as well as to identify individuals who are homebound so that in-home vaccinations can be conducted. We're providing $5 million to the Centers for Independent Living, $4 million to the DD councils, $4 million to the USAIDs, $4 million to the Protection and Advocacy grants, the P&As, $26 million to our Aging and Disability Resource Centers, the ADRCs, and $5 million to actually build and enhance the capacity of our Aging and Disability Call Center to refer individuals to community-based organizations in order to get direct assistance. Next slide. So this CDC ACL agreement has a number of purposes in it. So I thought I'd highlight them for you. The first is disseminating credible information about the vaccines and helping direct people with questions to additional sources of information. Second is identifying people who may need help getting a vaccine, and that includes even those who are unable to independently travel to a vaccination site. The third is helping with scheduling. The fourth is arranging and providing accessible transportation to vaccination sites. The next is to provide technical assistance to local health departments and other entities on vaccine accessibility to make sure that whatever systems are in the states are as accessible as possible so that our populations can truly get to them. The third is actually providing personal support and attendance services, or just if a person needs an additional assistant to go with them. And the last is to remind individuals of their second vaccination appointment if that's needed. Included in these purposes is the identification of the homebound, those who cannot be safely transported, so that through our coordinated efforts with public health, we can provide vaccines in their homes. Next slide. So we are encouraging collaboration at all levels, at the federal, state, and local levels. We are remaining focused on our targeted groups, those who have historically been underserved, and this now includes the hesitant, which clearly after yesterday's pause with J&J is going to be even more difficult than what we thought. The low income, minority individuals, those with limited access to the community services, and in this case to vaccines, those lacking in family and community supports. We are setting up a system where people are going to be asked, do you have family members who can help you? You know, we're trying to get to those who otherwise, through every other means, we're going to miss. And so we're targeting specifically to those most in need and to those who have limited English proficiency. Next slide. This slide really shows the range of collaborations and partnerships of our Aging and Disability Resource Center, or No Wrong Door grantees, both at the state level in terms of their partners and at the local levels. And as you see, it's really quite extensive, but it's designed to engage with all potential partners so that we can reach deeply into the community and really hit our target, finding those most at need. Okay, next slide.
There's like 10 minutes. Let me just
I'm going to interrupt. Please mute your line if you can. Thank you.
Next slide. Thank you. So in terms of collaborating, it really is a basic function and requirement of our Aging Services Network. In the Older Americans Act, it requires area agencies to build a comprehensive and coordinated service delivery system. And this slide is designed to depict that. And it's really an acknowledgement that we don't fund all of the components of a system that can benefit our populations, but that we coordinate so that appropriate referrals can be made, as well as the necessary supports and services can be provided to meet the needs of our populations. Next slide. As I mentioned, $5 million of the CDC funding is going to be used to enhance our existing call center, which is the elder care locator, to handle additional aging calls and to replicate the system for people with disabilities so that they can be referred to local entities that can provide them the assistance they need accessing vaccines. The disability line will have a separate number and clearly a different name, and it will be staffed by information specialists who will be trained in disability culture. Next slide. And lastly, we have been very fortunate to receive additional support from the American Rescue Plan Act, where we will be receiving $460 million for our home and community-based supportive services, which is a formula grant to state units on aging who have to give it to area agencies on aging, and they then give it to community-based organizations. And according to the Older Americans Act and the American Rescue Plan Act, they would be responding to the 26 authorized supportive services listed in the Older Americans Act, but Congress added specific attention to COVID-19 vaccination outreach, including education, communication, transportation, and other activities to facilitate vaccination of older individuals, as well as the prevention and mitigation of social isolation and strategies aimed at alleviating the negative health effects due to this long-term stay-at-home recommendation. Next slide. So that concludes my presentation. Hopefully I was in my time frame, and I'm happy to engage with all of you, answer any questions or take any comments that you might have. Thank you again. Back to you, Megan.
Thank you. I'll turn it over to Margie at this point to moderate the question and answer time. Thank you so much, Edwin.
Sure.
Yes, thank you so much. It's always so great to learn about organizations that are out there doing all this work, and we're not even aware of it. It's so seamless and beautiful. Yes, we do want to invite at this time comments from folks who are on the line. Feel free to raise your hand or just put a comment in the chat. And you can see we put some initial question prompts on the screen, but please don't feel limited to those questions. Would anybody like to kick it off?
Well, as a kind of a co-moderator, I think I'll take that. I'll leverage my position there and ask the first question. So, Edwin, again, so much great work, as Margie said, and we just want to recognize the connections and collaborations that that ACL is leading. And I'm wondering when you at the bottom of one of your slides, identification of the homebound is one of those activities that the Aging Network is engaged in. And of course, that's been one of the main challenges that we are hearing about from state to state to state, is finding out who all these people are. And so I'm wondering if you can share some of the strategies that some of the Aging Network agencies are using to help identify the homebound.
Sure. The first batch of homebound individuals that we anticipate identifying and that we are identifying are the clients we've already had on our rolls who are homebound. As you know, the Aging Services Network provides an array of services to assist individuals to stay in their own homes and communities. A great portion of that funded by supportive services, that $460 million additional dollars that we're going to receive. The 26 different categories of services includes home care, personal care, assistance with activities of daily living. For individuals who are already determined to be homebound, we allow states to define that. We don't define it at the national level, but it's usually individuals who have, and it varies all over the country, 2 to 3 deficits with performing the activities of daily living. States have their own assessments. Sometimes they're coordinated with their Medicaid waiver criteria as well. And, but we have an array of individuals who are already part of our daily service delivery packages, and they're known to our Aging Services Network partners throughout the country. In addition to that, we have seen an increase in demand for our services throughout the course of COVID. Initially, at the very beginning, we saw an increase as high, it's through one survey, it was as high as 95% increase. From what we're hearing now, that has sort of leveled off to about a 65% increase above our normal. And we generally serve about 11 million people a year. So that's a significant increase for our folks. I don't know off the top of my head how many of them have are truly homebound at this point. But what we have seen is that a great portion of those individuals will remain our clients. Initially, we were hearing that, oh, well, they were people who, you know, all seniors were asked to shelter in place. And so these are people who just were either hesitant to go into the community and continue to perform their activities of daily living or their aspects of community living like grocery shopping and the like, and they just asked you to provide services. That's true. But because of the duration of the pandemic, the fact that people have remained sedentary to a large degree, we've seen great declines in functional and cognitive ability. And as a result, our caseloads are much higher, and we expect that they will remain higher.
Very good. Thank you so much.
I'm curious if you could tell us a little bit your thoughts. It's early days still, but what do you think the pause on using the J&J vaccine might do to the rollout of vaccines for people who are homebound?
Well, we were on a call this morning, which included folks from CDC and from CMS, and we talked about that very thing. Clearly, you're hearing in the media, Dr. Fauci was on the Today Show this morning, you know, trying to get the message out that it's really the pause was a very good thing to show that we are really concerned about safety, and we're taking a very wise approach in terms of trying to ensure safety. When you look at the total numbers of vaccines provided against the number of people who have had some type of adverse or tragic reaction, it's quite small, but it shows that we are going to ensure that there is safety in these vaccines. We are hopeful that we will be able to turn that around and communicate that message to individuals. Up until yesterday, the challenge was to really address historic issues related to concerns about the public health system and vaccines in general. And I'm just not sure, and the fact that these were developed quickly. And, you know, we were all giving the message and encouraging folks, and the strategies, honestly, were to get to other trusted individuals in communities, faith leaders. I know in my own church, and I go to a historic African-American church here in Washington, DC, and we have, you know, we're not physically in the building, but we stay very connected, and it's designed with what they call class leaders. And so class leaders are responsible for the people in their class. It's their little small group. And so we had each class leader call for wellness checks throughout the pandemic. And most recently we called and said, have you gotten your vaccine? Do you need help getting your vaccine? And for those who were hesitant, we enabled those and provided information to those class leaders so that as their trusted person could say to them, well, I've gotten mine and the pastor has gotten his. It's those strategies that are very, very localized that we find to be the most effective. Therefore, for us, we're going to certainly start with our Aging Services Network, that visible, trusted source of information throughout time. But in addition to that, we are reaching out broadly to other community leaders recognized to be trusted and those who have their individual networks. And we're empowering them with information to combat hesitancy. But we think the challenge is going to be a little tougher than we anticipated with the J&J announcement.
Understandable.
For other ideas, if folks have additional ideas, we're definitely all ears.
We have discussed on previous calls that folks who are actively delivering vaccines in the home saw the J&J vaccine as a great opportunity because it means you cut your number of visits in half, and you can be a lot more efficient and get more shots into arms. So I'm sure that the ripple that this will have in that community is significant. Anybody on the line have any final questions, comments as we move into closing out?
If I could just have a short one.
Of course,
Okay.
Jane.
Edwin, thank you so much. It's always a pleasure to hear you and all the great work that ACL does and all the great leaders and staff that we get to work with at ACL. So I think the idea of the elder care locator is that's the line that you have been able to fund, which is such a great idea. I was just curious, as we've listened to various states, did you have quite a bit of an increase in the calls to the center?
We had, yes, Jane, it's so good to see you and thank you for the comment. We love working with the John A. Hartford Foundation and all that you all do to support the entire field of aging. We really thank you for that. And we appreciate you being a good partner with us. As it relates to the elder care locator, we have seen an uptick. And honestly, what we're trying to do, because when we engaged with the White House about the development of this call center, they were trying to figure out what can we do to make this better, to constantly improve. And so we said the elder care locator works very well, but if you overuse it, you can break it and it's not going to work for anyone. So what we're doing is a tiered approach. And hopefully I'm not revealing something that isn't yet public, but so I won't call the other agency. Another massive line will go up so that anyone can call and they will give referrals to state information lines and the like. We've given them a series of questions to ask, screening questions, to get down to individuals who don't have other means of support, don't have family members, don't have the internet, things like that, so that they can screen those out. Those are the ones that are going to be referred to the elder care locator and the disability line, so that then we can provide direct support to those individuals in their communities where they live.
Such an exciting and needed and valuable resource. Thank you so much.
Thank you. Thank you so much.
With our time quickly, as always, coming upon us, I want to thank you again, Mr. Walker, for taking time with us today. Incredibly useful, valuable information. Thank you for this wonderful conversation. We will be sharing the slides and the recording following this event. TIFA will continue to host these 30-minute huddle calls on Wednesdays and Fridays on topics related to enhancing access to COVID-19 vaccine for people who need them administered at home. Our next call is on Friday, April the 16th, and our featured speaker will be Blythe Ryerson, Acting Director in CDC's Division of Human Development and Disability. We hope that you will join us and spread the word to your colleagues as well. I've pasted the link to the registration for the April Huddle calls in the chat, and I want to thank all of you on the line here for all that you are doing. Thank you so much.
Please thank Blythe for our money.
Will do.
Thank you.
Take care.
Great.
Thanks so much, Edwin. Thank you.
Bye-bye.